Hey guys, welcome back to No More Cavities. Today we are discussing prevention of caries. So there are four pillars that help us to prevent the caries. The first is plaque control and toothbrush. The second is diet. The third is fluorides. And the fourth is fissure and sealants. So the first that we will be discussing is plaque control. So how we control plaque? We control plaque by disclosing agents. And what are disclosing agents? Consider these are our normal teeth. If plaque is present on these teeth, we will not know because we cannot see plaque by our naked eyes. But when we apply disclosing agent, it gives some color to plaque. So now the colored area shows that the plaque is present on teeth. The disclosing agent is present in the form of tablets or in the form of solutions. What we do for first week, first we apply disclosing agent and then we brush in the first week. But in the second week, what we do, first we brush and then we apply disclosing agent. Why? Because we want to see that what areas are being missed by brushing. The second thing that we use for plaque control is plaque chart. What are plaque charts? Plaque charts help us to monitor the progress of patient, that either the plaque is removing or not. So the second thing is toothbrushing. We all know that toothbrushing is the most important element for controlling the caries. Then the second thing is toothbrushing. As we know that toothbrushing is the most important thing for controlling the caries. There are something that we need to know, that how many times we should brush, how many, and when, which paste should be using, and what is the technique. So how many times should we brush daily? We should brush 2 times. And when? One in the morning, other in the night, before you sleep and after you awake. And which type of paste should we be using? We should use fluoride containing paste. And what is the technique? By technique we mean that we should not rinse with water. We should only swish the celery. What does that mean? That when we brush, most times what we do, we brush and we spit. After spitting, then we use water to rinse our mouth. But this is not the correct method. We should not rinse with water. We should only spit and swish the celery. The celery should remain on our teeth. So by this method, it will protect our teeth from caries. And the fifth thing is that the children are not able to brush by themselves. So when should we allow the children to brush teeth by themselves? When they can tie their shoelaces or write their name. Below 7 years, the child cannot brush because he or she does not have manual dexterity to brush. So the children should be supervised by their parents. The seventh thing that we should know is the amount of the paste that we should be using. How much paste should we be using? It is divided into children less than 3, greater than 3 years and less than 3 years. If a child is less than 3 years, then we should just give him a smear. Just a little smear. But if he is greater than 3 years, then we should give him a pea-sized paste. Now we will discuss about diet. So as we all know that sugary diet is the reason of causing caries. So we should not give the sugary drinks in bottle. We should avoid giving sugary drinks or any kind of drink giving in bottle. Then what we should prefer to give in bottle, we should give only water and milk. Only water and milk are preferred to be given in bottle. We should give those type of foods that increase the pH, and we should use safer foods. Sometimes what parents do, they give child nuts and chips to avoid giving bottle. But chips are too salty and increase the fats. And what is the problem with nuts? There is increased risk of inhalation. There is risk of inhalation. So we should not give chips and nuts to a child. Then a thing comes that is called non-sweeteners. What are non-sweeteners? These are non-carcinogenic foods not containing sugar but are sweets. There are two types of non-sweeteners. Either they are bulk sweeteners, either they are intense sweeteners. The bulk sweeteners should not be given to a child less than 3 years. Why? Because they have laxative effect. They have laxative effect. That's why they should not be given in a child less than 3 years. There are different type of bulk sweeteners such as sorbitol, mannitol, malitol, and xylitol, which is the most common use. In intense sweeteners, there is saccharin and thaumatin. These are the non-sugary sweeteners which are used to replace the sugar. Then diet includes one more thing, that's called diet advice. The diet advice is basically divided into first level and second level. What is the first level diet advice? The first level diet advice is to follow the basic advice. And what is the basic advice? The basic advice is to decrease the frequency plus decrease the amount of sugary diets. The first level actually is to receive the basic diet, to decrease the frequency and to decrease the amount of the sugary foods by emphasizing good habits. And the second level actually focus on analysis of diet. It includes an activity known as 3-day diary record. Advice is further divided into first level and second level. What is the first level? First level actually say to follow the basic advice, which is to decrease the frequency and amount. And the second level is the analysis of diet, which includes 3-day diary record. So what is 3-day diary record? The 3-day diary record is actually divided into 3 visits. The first visit, which is known as introductory visit. It is to motivate the child plus to introduce about the task. The second visit is about the diary collection. And what is about the third visit? It is the personal plus practical visit. In this visit, actually, we do the procedure that the child needs. When a child comes to you and the patient requests any kind of procedure to be performed, we will delay. We will not perform it in first visit. We will keep it for third visit because the third visit is practical and personal. So all the procedure will be performed in the third visit. This was all about plaque control, toothbrushing and diet. Thanks for watching and let me know if you have any query.